Yes.
Have you done any studies on children? Does this
Well, not studies, but application.
application?
We have seen tremendous effect in attention deficit hyperactivity, and Dr. Bradstreet, I mentioned, did the same, but they were not controlled, placebo-controlled studies. But I only recommend you, if you have, a son or a grandson or a daughter in school, take one of the rapid energy when they go to school, and their performance will increase remarkably. Yeah.
So I'm not sure, is not NADH on the WADA list?
On?
World Anti-Doping List.
I couldn't
Is
get
it, I know is it a synthesized product or a natural product?
No, it's a natural product. It's derived from yeast. We do not produce our NADH. The NADH is produced by Roche, by the Roche company. 500 kilograms a year. And there is no trace of yeast left. They make an extract, and then they run it from a 3-floor column down and end up with NADH. So it's absolutely natural, not synthetic.
Okay, and WADA is the World Doping?
But what?
World Doping, like athletes can they take
Very good
NADH?
question, yeah. We have a letter from Dr. Shamash, the medical director of the IOC, that NADH is not doping. We have a letter from the German Anti-Doping Association that NADH is not on the list of the prohibited substance, and it will never be on the list because we have it in our body.
Right.
And if you take 20 or 100 milligrams, we cannot measure it in the blood because it's immediately metabolized.
Right.
So for athletes, it's absolutely beneficial. Please, here.
Yes, there was a question on the pricing on the paper. It says 70 euros, and on the bottom of the brochure it says 7.
Auf der Broschüre steht
The brochure is 7 euros, and on the order form it says 70. Thank you for the comment.
Hopefully
to
it's
look
a
at
7
that.
euro.
Well, it's definitely 7, but you got it free of charge.
So the brochure costs 7 euros.
Right.
Okay.
But Natasha, can you now try to distribute these blisters? If you want, do you want blisters of any idea?
So is it 7 or 7?
The brochure is 7.
Yeah.
So the price, what?
No, it's 7. It's 7. It's 7. It's a comma. Yeah.
Oh, so the brochure is 7.
And here's the brochure is 7.
Right. Okay, so the price on here is for the brochure, but
Right.
the brochure is free,
Oh,
right?
Okay. Where is it?
Here they are.
Is it best to take it in the morning or in the evening, or when is it?
Morning and noon time, because it activates, yes, you will realize. If you take it in the evening, you may not sleep, you may not fall asleep, and it takes until midnight, So I would recommend to take it in the morning and then at noon time, depending on your workload. And so if you have a night job, then you can take it in the evening, of course. Yeah. What is,
For cancer patients, is there any advantage for taking it through IV over taking tablets?
what? I couldn't get.
For cancer patients,
Yeah.
is there any advantage taking it intravenously compared to taking the tablets?
Well, it certainly intravenous is an advantage, but intravenously NADH is a drug, and we do not have it available.
So that is not available in the United States?
Not yet, not yet. As soon as we have the approval as a drug, and we're working on that, in terms of Alzheimer medication, we are in phase 3, the final phase of a drug submission. It will take another 2 years and a couple of $1 million to pay for the multi-center study. But if it's registered as a drug, then we will have the IV, the parental form available. But the tablets work almost as fast, and the fastest actually you have from the skin serum. I have a friend who does kinesiology. You know what kinesiology is? If you, yeah? And he did a test, one leg stand, and the patient takes the arm, or a doctor, and he pulls him down with 2 fingers. Then he takes the spray, and after 5 minutes, the doctor stands stiff, and he cannot even, push him down with his entire body weight. In between 5 minutes. Yes, yes.
Could you elaborate on the treatment for macular degeneration?
Yeah. I have a doctor from Bulgaria, a female doctor. She could not see me. She could not even see my contours. and she took our NADH vision, and after 6 months she could recognize my face with, not very focused, but she could, and she told me she can read with a hard, magnetic lens, with a magnifier. That's an improvement, and we have about 5 or 6 patients of my own, and this doctor in Germany has much more. So it's definitely a benefit. But it does not work overnight. I mean, it may need 4 or 6 months, but it will definitely lead to an improvement. Yes, okay.
The cost and how would we order it?
Order it, yeah. Either fill out the order form and fax it, or by email, or by our website. And we have contact with Visa and Master.
And the cost is different than what's on the sheet though, because that's euros, right?
Yeah, right.
Okay. So the cost, again, American?
The card, American.
Could be
Well,
like
we-
$90. It depends on the.
Yeah, right, yeah. It's about, for the rapid energy, for the 20 milligrams, it's around $90.
Ja, sag bitte, dass man das sublingual nehmen muss. Er hat jetzt eben
I forgot to mention that the rapid energy is a sublingual tablet. You
So
have
the samples that are being
Right.
handed out,
you should put it under the tongue, and it will dissolve in less than 2 minutes.
And they're 10 milligram or 20 milligram?
This is 20 milligrams.
20 milligram.
20 milligrams. Yes.
What is the, I only got a glimpse of it on the screen, what is the protocol you use for the diabetes, including, besides this, there are other supplements you were using to treat type 2 diabetes, which is what I'm doing?
Yes, the protocol is that I give my patient 60 milligrams daily on NADH.
Okay.
And then we measure chromium and zinc, and they have a deficiency in chromium or zinc, we substitute that.
Chromium and zinc.
Yeah, right.
Okay.
If there is a deficiency.
If there's a deficiency, okay. And there wasn't like arginine or anything like that?
In one of the patients we gave arginine.
Okay.
Yeah.
And in what case would that be used?
Arginine you need at least 1200 milligrams per day, because otherwise arginine will not enter the cell. We do have arginine in the cell, so you have to have a higher pressure outside to get arginine into the cell. And this is accomplished by 1200 milligrams of arginine.
I see. Is it necessary though for the treatment of diabetes?
For diabetes? No,
Yeah.
not necessary.
Okay.
But NADH is necessary. And gives, what we have seen also, that NADH improves insulin production.
Oh.
So we are reluctant to give it to type 1 diabetes because they inject insulin. And if NADH stimulates insulin production, they may have a low blood sugar. So it's very difficult. By my friend whom I met quite a while ago, Jonathan Wright in Seattle, he's giving that also to type 1 patients, but he controls the blood sugar level every 2 hours. And he told me, and we met him, you remember, in Cancun, that he got 3 or 4 patients off the insulin. Good for the patient, good for Jonathan, but bad for the family. Yeah.
Was that on type 1?
Type 1, yeah. But I'm reluctant. I do not recommend a type 1 patient to an insulin dependent to take it, because if they don't control it, then they run out in a hypo, and that's risky. Yeah.
If you're on a B complex that has B3 in it, or you're taking that, you mentioned yesterday that perhaps is not a
Thank
good
you,
idea.
Connie, for that comment. Very important.
Yeah.
Some people claim that if you take high dosage of vitamin D3, you will experience the same effect with like NADH, which is absolutely not true. We did an athlete study, which I did not report on. Olympic athletes, 4 weeks of NADH have 10% more ATP in the muscle. That was tested by biopsy. And the control group took B3, 100 milligrams, no improvement. So, and vitamin B3 also, NADH is the coenzyme form of vitamin 3. Vitamin B3 blocks the effect of NADH. We don't know why, but it does. So I'm not so fond of vitamin B3 because but B3 complexes causes rashes and allergic reaction, etc. And yes, please.
So, if you're taking a number of Medicaid or supplements,
Yeah.
taking NADH would be beneficial, and you could stop taking like B complex and vitamin D3 and
Yeah.
iron and.
I would, yeah, absolutely, I agree. I mean, if you take other supplements like selenium or vitamin E, I advise my patient to do a test, a blood test. If you have a deficiency in selenium, then you should take selenium. But you should not take, compounds from A to Z, We did in our research laboratory, for example, we did analysis. We took vitamin A, C, and E into gastric juice. And all the supplements end up in the gastric juice, which is very acid, it's 100 times more acid than vinegar, and it's 37 degrees. And we found compounds which we could not identify. So this multivitamin is, for me, it's a wrong philosophy. Take what you need. And to point out that all people, not only you, but even Olympic athletes, have an NADH deficiency, because otherwise they could not improve, as we showed.
From an economic standpoint, you could wash out because you stop buying the supplements and buy this and take one and one way.
That's a good comment. I mean, I agree, I totally agree.
All right.
You benefit more from NADH than from hundreds of supplements.
Including C and E.
Yeah. But I can make another comment. Everybody believes that vitamin C
Yeah.
stimulates the immune system. The biggest producer of vitamin C is Roche in Switzerland. And the Roche in Switzerland admits in their annual report there is not a single scientific study showing that vitamin C stimulates the immune system. This is just in the brain, and they have PR agency, their marketing agency, that vitamin C stimulates the immune system. But what vitamin C does, it protects you from the damaging effect of smoking. And NADH does that as well. We have a study with smokers at the University of Graz. If you smoke, you can measure the damaging effect of smoking in the blood after 10 minutes of your cigarette. If you take NADH, the damage is only 10%. So for all smokers, NADH is a must. Or stop smoking.
Or start smoking.
Who stops smoking?
Same one, no?
Fine, so yes,
I'm
please.
trying to understand the invoice here, it says package equaling 10%.
Oh, that's the, including the value-added tax.
VAT, yeah.
Oh,
including
okay, the
the-
VAT tax,
The
okay.
MWST is the German for value-added tax.
Okay. For the
Yeah.
10% tax.
Do you have a clinic in Austria?
No, not anymore. I had it until 7 years ago. But I'm rather an old guy, and I'm focusing only on NADH, and that keeps me busy. Can you ask my spouse? We are traveling, quite. I would say every other week we are in Czechia, we are, in Germany giving talks. I invited to talks. No, but to answer your question correctly, I do receive patients. If they want to see me, they can come to Vienna, and but I do not do telephone treatment because I want to see the patient.
Sure.
Because then I can judge what he needs and how he's feeling.
Okay. I have a sister-in-law in Vienna, so
But
I have a sister-in-law in Vienna.
yeah, right. I think this is Vienna.
Yeah.
But yeah, here you have my website,
Right.
and you can contact me by the website.
Did you say
Yes.
that patients on chemo, this doesn't impair that or aggravate the treatment? Is
What
that
do you
also-
mean?
Patients on chemotherapy,
Yeah.
it does not have an effect?
No. What we learned that we have I have two types of cancer patients. One decide to take chemotherapy, that they don't miss anything. If they take NADH, 80 milligram, they have much less side effects. And the other group, chemotherapy is killing by prescription. They are doing much better. They're recovering much faster.
But it doesn't prevent the chemo from working. It doesn't
No,
prevent.
yeah, that's a good point. No, not at all. But the question is whether chemo works at all.
What about someone that's on chemo and radiation, really getting dosed?
Yeah, he should take NADH, and he will. I just got an email from the ambassador, Austrian ambassador of Alger in Algeria, and she had a friend. She was on chemotherapy, and she said she tolerated the chemo much better with NADH. It's my recommendation. If one decides to take chemotherapy, then she should take NADH. I gave a lecture at the Princess Schwarzenberg. She has a special lecture program in Vienna, and I spoke about NADH and cancer. And there were mainstream colleagues as well as homeopathic and automolecular. And at the end of the talk, I raised the question: is preventive chemotherapy meaningful or not? If you have no tumor, if your surgery removed, etc., no tumor in the body, most mainstream doctors say you have to take preventive chemotherapy. Now, the good thing on chemotherapy is it kills all fast dividing cells, including the hair and the mucosal cells and also cancer cells. But after stopping chemotherapy, the mucosal cells in the hair came back, and so the cancer cell will come back. So chemo has no effect. But if the cancer cells do not come back, they were not there before the preventive chemotherapy. So I didn't get any reasonable answer on that. Yes?
Have you had any experience with treating people with NADH with hepatitis or HIV?
Yeah. Hepatitis, particular hepatitis C,
Yeah.
the titer goes down, not to normal range, but considerably.
Okay.
And HIV is another story. HIV has never discovered. I mean, the virus is never documented, isolated. But what I see, and I have an AIDS patient with Kaposi sarcoma,
Yeah.
and he took NADH since September, and I got his results, and the CD4 and CD8 ratio, improved. Not normal, but improved, and he feels much better, etc. So I think they should try it.
Yeah.
But it's very difficult to do controlled clinical studies in cancer patients as well as in AIDS patients. Nobody will do that.
Back to the Parkinson's.
Yeah.
I have a friend who's like 55 or so, and this Parkinson's is really bad. I was pretty impressed at that little
Yeah.
thing. So how many, to get those kinds of results, how many of them would he have to take per day and for how long?
Yeah. Well, I'm sure that he's taking the classical medication, some sort of L-dopa,
Probably,
etc.
yeah.
Then he should start low with only 2 tablets of the rapid energy, one in the morning and one at noontime. And he should experience an improvement in 1 or 2 weeks.
1 or 2 weeks?
Yeah, if he gets an improvement, he can increase the dosage. We are reluctant to start in with high doses because NADH makes L-dopa. And if he gets Madopa as a tablet, then he's experience overdosing effect. And then he should reduce the L-dopa or skip the L-dopa, totally after a couple of weeks. I would say he should take it until the rest of his life, like this patient I showed in the video.
That was pretty impressive.
Well, it's not only one. We did another one who was in bad shape, and he could not get up with the lift with the help of my late father. And after half an hour with NAD, he also got up and jumped. But that video was taken by myself, and I'm not a professional, whereas the video I showed was done by a very professional company. Now try it out, and they will definitely improve in terms of mobility and in terms of depression. Because many Parkinsonian patients, due to the dopamine deficiency, suffer depression.
What about like the shaky?
The shaking depends. Some people, it's getting better, and sometimes it persists. But the shaking is not the major concern of the people. The inability to move is their concern, and also then in speaking. By the way, speaking, articulation is the first sign of Parkinson's disease because the laryngeal muscles are the most sensitive. And in Parkinsonian patient, all muscles are affected. So if you have, if you know somebody and believe he has Parkinson, you can do a test with difficult words to pronounce and to articulate. Yes?
Have you found any effect on people who clot a lot, their blood clots?
And
For people that have clotting disorders, where
Yeah.
their blood,
Yeah,
they get deep vein thrombosis?
no, we have no experience from that. There was another.
How long does it stay in the system?
How?
How long does it stay in your system? So,
That's a
Is
good
there-
question. Normally, if you take a tablet, you can measure the concentration in the blood, let's say after an hour, and then it fades off. If you inject NADH intravenously, after 10 seconds, it's gone. It's not metabolized, but it enters the cell like the white blood cells, etc. The tablet, let's say the effect of the tablet, lasts 4 to 6 hours. And the injection, the IV, is only for 1 or 2 hours with an enormous improvement, but then it fades off much faster. Okay. Yeah.
One last, sorry,
Yeah.
conversation here. I'm curious, since you had mentioned hepatitis, can it also treat someone with cirrhosis in their liver?
Cirrhosis, I cannot recall a single patient, but I think it may help. I mean, they should give it a try,
Yeah.
because it cannot do any harm. You know? What we have experienced, if you focus on the liver, it reduces the alcohol content in 1 hour or in half an hour by 1 per minute. And that's important. That means that it works on the liver. And the liver enzymes, are stimulated. And that holds also for drugs. If you're supposed to take drugs continuously, I think NADH will protect the liver from the damaging effect of many of the drugs, including cholesterol-lowering drugs. They are really harmful for the liver. Okay, it was a pleasure having you. Thank you. I keep telling my grandchildren, thank you for coming and thank you for going.